system. So that's not just SPFT, not just the mental health trust, but the whole system. So local authorities, services, public health, and the voluntary community sector, people live variants and so on. We set up Sector Connector, and we meet times a year, using a different themed approach each time. And this time around, it's Foundation for Our Future. So welcome to that. We are recording the meeting, by the way, and we're going to have an hour together with some speakers, and then we'll break up into more locally based breakout groups, one for East Sussex, one for West Sussex, one for Brighton. So our speakers today are, first of all, Simone Button, who is leading Foundation for Our Future, and then we've got people, Josh and Amy and Ed, who are going to talk to us about what the Foundations for Our Future and the strategy for Foundations for Our Future means in the families and young people. So if you would, any questions or if you should comments that come up, if you could pop those into the chat and leave some time to address those at the end. Yeah.
Yeah, you seem to be breaking up, and we've got quite a few messages in the chat to say that people can't hear you properly.
Well, people aren't hearing you properly. Is that right?
Yeah.
Is that the same experience for everybody?
Yeah, maybe close down the video, it may help.
That's a good idea.
The best thing is, let's just go on, okay? Let's go for Simone.
Simone, I think David was saying, shall we just crack on and start with you, if that's okay?
Yeah, that's absolutely fine. I'm reliant on Hadi to share the screen though, because I don't have the ability to share my screen apparently. Hadi, are you able to do that? Is Hadi there?
Hadi? Oh. Oh dear.
Okay.
Sorry,
we're having some tech issues. It's only Will that can share, so I'm going to send you a PowerPoint to Will. Sorry, I was a bit quiet because we're trying to sort that out in the background, and he'll do that for us. Bear with me 1 sec. Ed, can you send me your presentation as well?
Let's go to Simone.
I've just sent it to you now.
Okay, thank you. We get that sorted straight away.
So are you going to be able to share my screen, Hadi, or share my presentation, or am I going to talk to it? I'm slightly confused.
Sorry, Will's got control of the screen, so I don't have the option to share. So Will is going to do it for us. So I'm just sharing your PowerPoint with him.
So, hi, I'm just waiting for to receive it, and then I shall share
let's
it.
go to Simone.
For some reason, it's not allowing it to be shared out, so that other people can share their screens. So as soon as I've got that, I'll put it up on.
Okay, thank you. I'll just while you're waiting for that, Will. So I'm going to give you a short presentation on the Foundations for Our Future programme, detailing the scope of the review. I'm going to talk a bit about the themes and the recommendations, and many of you will have been involved in it, that came out of the review, and the progress with some of those key areas. Predominantly, I'm going to describe in a bit more detail the work that's been undertaken so far to develop an emotional wellbeing and mental health strategy for Sussex, which was one of the key recommendations. If you didn't hear David clearly at the beginning, my name's Simone Button. I'm the Programme Director for Foundations for Our Future.
If everything has worked, you should be seeing your presentation.
I can just see you at the moment, Will.
So you can't see the presentation, okay?
Shall I, in the interest of time, what I could start doing is if I just start talking through the presentation, and hopefully you'll get the gist of it, and when it emerges, is that the best thing to do you think?
Yes, can I just ask, can anyone see the screen now?
No.
No.
It's very says, I mean, it's strange, it says it's sharing. Okay, apologies.
So, Foundations for Our Future. So this was a Pan-Sussex review, which was commissioned by separate CCGs at that point. So for each of the areas, now one care commissioning group, Sussex Partnership, or something looks like it might be happening. No, okay. Sussex Partnership NHS Foundation Trust, which of course is the Sussex-wide Mental Health and Learning Disability Trust, and the 3 local authorities. So it was commissioned system-wide. It was a whole system review, so it was a whole Sussex-wide of a review of emotional wellbeing as well as mental health services. The real focus on access and support to children and young people. And oh, that noise, can people go on to mute, please? And that was really because there had been a lot of feedback that services were to access and people were waiting for long periods of time. I think it was very much focused around people were only really particularly aware of specialist services. So that whole system review was carried out. Lots of people were involved in and engaged in that review. Many of you here will have been involved. So there were children, young people, families, all sorts of other stakeholders were actively engaged in completing surveys, attending focus groups, attending big events such as this to answer questions and to provide feedback. The report itself was published in March 2020, but there were delays in publishing that report and enacting it, the implementation of it, largely because, as you can see, that corresponded with the pandemic, and obviously everything was very focused on dealing with COVID. That wasn't to say that things stopped happening. There was a lot of work that happened, particularly in specialist services, but elsewhere, both in terms of supporting young people with information, but also in terms of developing a 24/7 crisis service so that young people and families could contact help around the clock. The review came with a 2-year implementation plan with 20 recommendations, which were arranged around a series of themes. And I'm just going to talk briefly about some of those themes. I think there was an acknowledgement that there was a need for a radical redesign of the service model with more effective pathways, better linkages between services, better links with that whole pathway, with a real focus on improving access and delivering much better outcomes for children and young people and their families. There was a need for recognition, that there was a need for focused investment on priorities and outcomes. So really thinking about how do we spend money on developing services that are our priorities and are going to deliver the very best outcomes for children and young people. That although there was acknowledgement that there was some good partnership working happening, it wasn't as effective as it might be. And there was more to be done to really make sure that everybody, the whole system, was working really closely together. And this is very much around that this is something about it being everybody's business. That having young people and their families' voice at the heart of all we're doing is absolutely key. And we really need to make sure that we are listening, but also that we're involving and engaging youngsters and their families in co-production and co-design. So any of the transformation and the changes that we're making, we're doing it with young people. That there was a need for a much more coordinated approach to commissioning, so a more strategic approach to commissioning, and really thinking about the leadership that we need to have in place to drive forward the improvements that are necessary. Accompanying all of that was the need for a strategic outcomes framework. So really thinking about what are the outcomes that we're looking for and how do we to that return on investment, to how we're spending our money. Although there are lots of services around, I think people were finding it very difficult to navigate their way through and to find, to be able to find the right service very easily. So one of the actions that came out of that review was the need for a simple provision map, which would ease navigation for young people, families, as well as other referrers, so that help can be sought easily and quickly. And that although this was a Sussex-wide review, I think there was a recognition that we really need to be focusing on that level of investment at a local level to meet the needs of local populations. And that was really in response to the fact that when the review looked at the resource that was being spent across Sussex, there were different amounts of resource being put into different services in different areas. That although lots of organisations are providing a lot of data, there was a lack of accurate available data that would enable us to make some sound decisions on how to drive forward improvements. So the need for that accurate available data and using one system and one approach to collecting that data was required. And finally, it will come as no surprise to you that there was a recognition about the workforce challenges. So how do we make sure that we have enough of the right staff supporting and working with children and young people, that they have the right skills and competencies to help those youngsters develop and to achieve the very best outcomes, as well as thinking about sort of development training, as well as recruitment and retention. So the next slide I would have been showing you would have detailed those 20 recommendations. And in parallel, there has been a lot of work that has been happening through the Children and Young People's Mental Health Delivery Plan, and that's hosted by the Mental Health Collaborative. That group or that work, that transformation work is responsible for delivering a lot of the ambitions that have come from the long-term plan. So we knew that a lot of that work was already happening, and then there are some very specific actions that are not being delivered elsewhere that are being taken forward through Foundations for Our Future. So what's been really important is to align those two programs of work so we're not duplicating and we're delivering on all of the things that we want to. And there were 3 of those recommendations that I really just did want to pick out as being particularly important. Recommendation 20, so it's the last recommendation, but it is probably one of the most important, which is around, again, it picks up that earlier point about making sure that young people are really actively engaged and involved in co-design and co-production of the changes that we're making. And one of the suggestions would be a forum or a group that would lead on some of that work. I'm not going to say too much more about it, apart from to say that we have really actively involved young people in a lot of the work that we've already taken forward. But Ed, Josh and Amy are going to talk a bit more about that in a minute. Another key recommendation, recommendation 11, was about the development and implementation of a single point of access. So this was really key. It's a really key recommendation because it's about making sure that all referrals or requests for support to make sure that young people get the help that they need go to one place, and that they are then directed to the right service, which will make sure that we're providing very timely access to support. East Sussex single point of advice already has that in place, so there's some further developments underway, but a lot of that is already there. Been quite a lot of learning from them for Brighton and Hove and West Sussex who are currently working on developing their own models, so that by June of this year, there will be a single point of access, single point of advice in place for both West Sussex and for Brighton and Hove. The programme talked about having a single model, but we decided very quickly that actually we couldn't necessarily have a single model, but what we did want to have is whatever model is being implemented would comply with some core sets of core principles. So we've developed the core principles, we've developed those with young people, and they've commented and given us some very helpful feedback on what those mean and what should be in place. And all of those models of single point of access will conform and comply, as I say, to those core principles. And then the last recommendation I really wanted to talk about and spend the rest of the presentation talking about this is about having one strategic plan for emotional wellbeing and mental health for children and young people in Sussex. And we've been working on this with young people, families, as well as professionals to produce a draft strategy, which you would have seen and would have come out to you as part of the reading materials for this meeting. Important to be aware then that what we're trying to produce is a document that's for everyone, that describes our vision, aims and objectives to meet the emotional wellbeing and mental health needs of young people across Sussex. And it will interface with other children's strategies. So we want it to interface with the physical health strategy that's being developed, the learning disability and autism strategy, so that we can work together on those areas of interdependencies, those crossover areas, so that we can deliver shared outcomes. And one example of that would be, for instance, for thinking about how to best support young people with an eating disorder. That obviously has a very strong physical component, but an emotional wellbeing and a mental health component as well. So we want to think about how we deliver that pathway together. The strategy is Sussex-wide, but it will have local area implementation plans that will take account of the specific needs of the population in that local authority area. So there'll be an implementation plan for East Sussex, for Brighton and Hove, and for West Sussex. And that will ensure that we're thinking about the partnerships that are in place in each of those areas. But we do, however, want the same high quality outcomes to be delivered to all young people.
Now you're missing a right party on Zoom here.
Of where they live or their level of need. So we've worked together with a lot of people in relation to this. We've involved a co-design group of young people and families who have worked on the design that you've already seen in the copy that you've been sent, as well as have made comments on the content. Public health colleagues have been very actively involved, and they've produced a rapid needs assessment. So that's taken account of the changing needs of young people as a result of COVID and the impact, the significant impact on them, and how we need to respond to that. So that's informed some of the direction of travel and the actions that we're proposing to take within the strategy. Our vision is to keep young people emotionally healthy so that they can lead healthy and productive lives, and they're supported to be as resilient as possible. And where support is required, we want to ensure this is delivered as early as possible and in non-stigmatising environments. Where young people need more specialist help because they're more unwell or they have complex needs, we want to make sure that that is readily available and for all levels of help to be easily accessible. And finally, and really importantly, with transformation now and going forward, we want the voice of young people and families to be heard. So in your strategy, on page 9, there is a strategy on a page, and if we were looking at the presentation, that'd be the slide that I'd be showing you now. So just in terms of the enablers, how will we support delivery? Well, what's going to be really important there, we really need strong leadership, we need strong governance so that we have got clear lines of accountability to making sure that the actions that we want to deliver in that implementation plan will be delivered. We want everyone to work together to making decisions together. So that is going to be a really key enabler as well. And having a skilled workforce is going to be incredibly important, as well as using digital support as a way to maximise access and to think about how we move forward and to making sure that we're producing good data, good and reliable data to tell us what is being delivered and how we need to be improving as we go forward. We have a number, therefore, of strategic priorities. So priorities that really focus around prevention. As I say, within this strategy, it's really important that we think about how we develop the resilience of young people and we prevent mental and emotional ill health, and we promote emotional well-being and mental good health. A priority is also around the early help and the access to support and making sure that's in place. And as I say, specialist and timely support needs to be in place to meet high needs. And finally, and really importantly, our last priority is around the life transitions. So we want young people throughout their whole childhood to be supported through those transitions. But in particular, we really want to make sure there's the right support for young people who are transitioning into adult services. There's a lot of work that's happening as a result of the long-term plan, which is around a pathway for 16 to 25-year-olds. So that will be part of the actions that we're taking forward to think about what services need to look like for that age group and how we're, as I say, providing that support from children into youth services, into adult services in the future, and to make sure that that is meeting their needs. To deliver the priorities within our strategy, we have a number of action areas, and these focus on how we will prevent emotional and mental ill health and promote good health, how we want to work to ensure these ambitions are reached, and finally, how we will improve the support provided. So in terms of focusing on prevention, we're talking about what are the actions that we need to take to address things like bullying and sexual violence, to support suicide and self-harm. And these are programs of work that are already in place, but we really want to join them up with this strategy. How do we treat and support families where there is parental substance misuse and mental health problems? And what are we doing to address some of those social determinants of health for high and complex needs? So some of the things that we know are really going to impact on mental ill health. In terms of ways of working, I've already said, thinking about making sure that we've got a single point of access in place for really enabling those referrals to come together in one place is going to be a key new way of working, as is taking a whole school approach. Schools have a vital role to play in the delivery of this strategy and to the delivery of emotional well-being of pupils within their school. And we want to create mentally healthy schools as well. A whole family approach is really key. We want that to be well coordinated with partners and everyone working closely together with the family. And finally, as I've said, supporting transitions to adult services. In terms of how we'll improve support, we want to do that by providing early support, including mental health support teams in schools and the further rollout of those teams. Thinking about the ongoing improvements that we're making to specialist mental health services, our CAM services, improvements and developments with our crisis and urgent support, and finally providing very specialist pathways of support for high and complex needs and making sure that those are working effectively and well. And those will deliver the outcomes that we know that young people have asked for. They want to be supported to develop and achieve their goals and to have inspiring futures. Families need to feel supported to cultivate and develop resilience in themselves and their children. And the voice of children and young people needs to be valued, heard and acted upon, with help readily available to keep young people well. And where more help is needed, this is provided early. And finally, children and young people receive the right help at the right time, making interim support readily available for people needing extensive treatment that can take longer to find. The final slide I would have shown you, some of you may be aware, but this relates to our implementation of the Thrive framework. So as part of the delivery of the strategy, we plan to introduce the Thrive framework. This is a nationally recognised model of good practice, which enables us to provide a pathway approach to care and support, with a focus on how to keep young people well and thriving, but enable access to more support if that is needed. And partners across the framework will work together to ensure the needs of young people are met, and they and their families are at the centre and involved in that shared decision making. So it's very much how we all have a role in delivering this strategy. And as I say, we want to make sure that this is delivered hand in glove with the implementation of the strategy. It's a vital part of the strategy. As I say, it's currently in draft form. The next are for an extended oversight board. That's where the Foundations for Our Future is driven through. We're going to hold a workshop at the end of April where we want to just draw out a few more areas. We want to think and make sure that we've got the governance and accountability right within that strategy. We want to think a bit more about whether areas and interfaces with the other strategies need to be spelled out a bit more. And we need to check that we get anything out, that we haven't got any gaps. And finally, we want to develop the accountability piece, but also the accompanying outcome framework. Once we've done that, which, as I say, will be early May, we then plan to share the draft document more widely before that's published. And then there will be, as I say, more work at a local level to implement that as we publish the strategy. They will follow the implementation plan about what that's looking like, how we bring that alive. And that's where everybody here and many other people will have a role to play as we take that forward. I'm sorry you haven't seen my presentation. Happy to share it afterwards, but hopefully you've had a chance to have a look at the strategy. And I'll hand back to you, David. Thank you.
Okay, thank you. Hopefully now people can hear me. I've switched to a different device, so and apologies for the technical hitches we had at the beginning. Just to reiterate, folks, if you've got any questions, queries, or comments, please pop them in the chat, and we'll get round to them either at the end of this session or during the breakaway groups. So could I now welcome Amy and Ed and Josh, who are going to give us a young people's perspective on some of the things you've just been hearing. So over to you, folks.
Great, thanks, David. Natasha, is the plan for you to still share our slides?
I have shared them, so can you see them?
That's the real question, isn't it? I can't
see anything now.
No, okay. I don't know
and
what.
Ed, can I say you're very loud?
Oh, okay.
Sorry. And a little bit robotic, just for the audience.
I think we're all having tech problems at the moment, aren't we?
Oh, okay. I'm going to put it into the chat so everybody can open there. Amazing.
So I think because of time and tech problems, I think we'll just get started. So we just wanted to talk a bit about our work with children and young people in terms of participation work and co-production, thinking about some of the work that we're supporting, some of the sort of possible avenues as we go into sort of that sustainable period after Foundations for Our Future and what that might look like. So yeah, Josh, did you want to start us off and talk about some of the involvement work that we've done so far? This is a little bit tricky because a lot of our slides are very sort of engaging and we've got some models that we want to share, but hopefully you can view those in the chat still.
Yeah, great, thanks, Ed. Should we just do a quick round of introductions? I'm Josh Jenkins, a CRP mental health consultant looking at children's social care and mental health. Amy?
Hi, I'm Amy. I'm an expert by experience of CAMS, and I'm also a youth volunteer for Young Health Watch in East Sussex.
Great. So over the kind of last couple of years during Foundations for Our Future, and especially within like the last 6 months or so, we've worked really closely with several youth groups across Sussex, including YMCA DLG, Download Group, Concordia Youth Forum, the CYP Clinical Academic Group, and then looking at that wider youth voice in Sussex. And they've been really valuable to Foundations for Our Future, looking at what they think is missing and what they want in the strategy, looking at the recommendations and how to access this, reviewing the kind of language, how that is shaped and designed. YMCA Download Group have looked at the digital review of the mental health CYP support systems online. They have created films to help young people kind of understand confidentiality and tips for feeling safe during group discussions that we all kind of collaborate with them on. Looking at the youth academic group, the clinical academic group, sorry, they've been really engaged in the single point of access and looking at the core principles for Sussex. Again, looking at language and reducing some of that system speak that we all use on a kind of daily basis. And then, unfortunately, you won't be able to see this next slide, but if any of you are looking at it on your own computers, it is slide 3. And this just kind of gives an overview of the current involvement that children and young people have within the Foundations for Our Future and the single point of access. So Brighton Youth Council have been involved. We've got youth participation and public involvement research cafe that have been involved. A lot of schools, colleges and university councils and forums have had great participation in co-design. YMCA and the Wellbeing group, we've had experts by experience like Amy, myself and Ed. We've got Young Health Watch, both in East Sussex and West Sussex, that have been involved, additionally with Brighton and Hove. And then our youth cabinets and youth councils have been really devoted, I'd say, to pushing this kind of co-production and co-design forward from the ground up, just so that we can shape the services that we use and not get shaped services for us. Ed, do you want to move on to Shout Youth Voice and Participation?
Yeah, of course. I've moved back a bit and I'm hoping I sound a little bit quieter. I forgot to introduce myself. I'm not an expert by experience. I'm a participation worker. So I work for East Sussex Community Voice and Health Watch East Sussex. I also do 1 day a week with Children's Services supporting the East Sussex Youth Cabinet, and I co-chair the Foundations for Our Future Oversight Board. So a nice little bit about me there. So we wanted to talk a bit about why we actually need participation, which I'm not going to go into too much, only because it's quite visual. So I would recommend having a look at our slides that are in the chat now, and maybe something to go over a little bit later. But something I do want to touch on, which is slide 7, if you go through the slides in the chat, is the NYA Youth Work curriculum. So I thought this would be good to sort of introduce. It's a shame I can't screen share because it's a really nice sort of colourful wheel. But what I want us to sort of take away is that when we involve children and young people, there are so many wider things that we need to be thinking about as sort of professionals. And I think one of the things that I'm really keen for us to have in the back of our minds is that when young people participate, we need to be thinking about sort of the social benefits, any sort of friendships that they might make, any sort of learning that they might get around the system, the NHS, understanding how that works, any sort of paid work experience or things that might be useful for further sort of job or career opportunities. All of those things, I think we need to remember that when we involve children and young people, all of that adds value to the work, and we need to remember that, you know, when we are engaging with young people, that it's important that they leave a session or a youth group with some of those needs on the wheel met. So I just wanted to have sort of a bit of a discussion about that. Amy, did you want to talk about co-production that we've done so far?
Yes, well, since early January, us three have come together to start on this project in terms of what we got from Foundations for Our Future, and we started to not only create a proposal for hopefully a very big, wide range of youth participation, which all leads up to the government's board, and so young people's voice are always in the mixture. So what we're hoping is to have 3 boards for each area, so 1 for East Sussex, 1 for West Sussex, and 1 for Brighton and Hove. And it should lead into all youth groups in the areas, and hopefully we don't miss out any young person's view, because it can sometimes, well, a lot of young people's voices can get lost, because I mean, even now thinking of it, although there's youth participation now, I would say mostly the most confident young people get involved in that, and we don't want to lose out on anyone's opinions there. We're also planning to do young community ambassadors, where they will have a very integral part of this, where they will be able to come to meetings, we'll be able to do activities, like Ed said, work on personal development as well. And then they can go out to their own communities and talk about the changes that we're trying to plan and just make it more widespread. And hopefully it will be brilliant.
Cheers, Amy. So we're going to just have a quick, and it's a shame you can't see it because it's a really good infographic, but on the last page of the PowerPoint that you would have looked at in the chat, there's something called the governance and sustainability structure. And this is looking at where youth voice fits into our current governance structure around children and mental health across Sussex. So at kind of your bottom runs, you've got the Foundation for Our Future CYP Engagement and Participation Group, the Single Point of Access Review and Development Group, and then the Foundations for Our Future CYP Strategy and Outcome Development Group. Just above there, you've got the Foundations for Our Future Project Group, which sits alongside the CYP Operational Delivery Group. And I sit in the project group as a EB consultant looking at strategy. Above that, you have the Foundations for Our Future Oversight Board. And what was really good is that we've now got Ed on board as our youth co-chair. And it's really good to kind of get youth voice into high-level strategy, because it really makes a difference, we believe. Above Ed's oversight board, we then sit the Sussex Clinical Commissioning Group governing body, and alongside that, you've got the Mental Health Collaborative Programme Board. Looking at location base, we've got the West Sussex Emotional and Mental Health Group, the Brighton and Hove Children and Young People's Mental Health and Emotional Wellbeing Partnership Group, and the East Sussex Children and Young People's Mental Health and Emotional Wellbeing Partnership Group. Directly above that, you've got all of the oversight boards for East, West and Brighton. And again, myself sits in the Brighton and Hove, and I believe there's some input from Ed and Amy on the other oversight boards, but not directly in them. Above that, then we go into the health and wellbeing boards across both East Sussex, Brighton and Hove and West Sussex. And the reason we kind of wanted to go through this with you today is to kind of really embed with you why it's important to have CYP voice in all of these different areas, because so many different parts get missed at kind of lower level. And if we can hold accountability at some more strategy level and senior levels, then we're going to be doing our children and young people a lot more justice. Just to kind of say around this, we've just brought on board, recently onboarded is Natasha Cummings, who is the Sussex CCG participation lead. And I don't know, Tash, if you want to say a little bit about your work. I think we found it really valuable having you on board. It's created some kind of safe working parameters for us. It's created some more structure for us. It's enabled kind of easier conversations. I don't know if you want to say a little bit more about your kind of day-to-day role.
Hello, everyone. Can you hear me? Yeah. So, yeah, I've been in post since November last year, and I was brought on board. I sit within NHS commissioners, but I work very much with SPFT, Sussex Health and Care Partnership across the board. But really my role is around strengthening youth voice and supporting the system to collate the views and opinions of children and young people. So like what Amy said, you know, thinking about what can we do at the place-based level in order to feed into all the insight into the structures that be, and then looking at where the gaps are, who do we need to, you know, which children and young people do we need to talk to, who are we missing in terms of insight. And when we're talking about children and young people, yes, up to 25 in terms of involvement there. So our core co-production group is kind of the advisory group for my work, really, and then wider than that, we're looking at engagement in the place-based areas. Thank you.
Ed, did you want to do a roundup?
Yeah, of course. I don't know if my sound is still bad. I have altered something, but I'm not sure it was the okay, well, I'll keep it very brief in that case. So yeah, I mean, as my colleagues have covered, we are very keen to see youth voice and participation across integrated care. I'm very keen that we don't lose the mental health remit, but we also expand and look at physical health. And I'm hoping that's something that, you know, we can keep those conversations going and do things like having our Young Health Watch in East Sussex. You know, we are starting to get there in terms of championing young patients in sort of that physical healthcare environment. But yeah, thank you so much for listening. Sorry that my sound is bad. We didn't have the slides up, but the slides will be in the chat and they'll be sent out afterwards. And if you do have any questions, please just email us, and hopefully in the breakout rooms as well, we can dive into some of this a little bit more. But yeah, thank you.
Okay, thank you ever so much to all of our speakers. Very thought-provoking, and that's reflected in some of the comments in the chat. By the way, as a kind of wash up after this, we'll make sure that all of the resources associated with this, the recording of the forum, the different presentations and so on, are all made available to everyone who was invited, as well as everyone who actually attended. We've got a few questions and we've got a little bit of time to be able to address them. So before we go into the breakout rooms, let's do that. There's one question here. Why no mental health support teams attached to colleges as well as schools, especially so given the large volume of young people being served by colleges? Is that one for you, Simone?
Well, it might be, but I don't know if I absolutely know the answer, David. My understanding was that certainly in the fullness of time, that they would be available to colleges as well. But I don't know. There are people here who may well be better to answer that than me. So in the audience, I don't know whether anybody's got an answer to that one. But certainly I can follow up and get back to people with. I absolutely agree with you, and you know, we're wanting to support young people of all ages, certainly those at college. So as I say, my understanding is that in the fullness of time that will be available to support young colleges as well, but I couldn't say that for definite. Okay.
Can I just ask Hattie, who's in the background supporting us, to make sure everyone can turn their microphones on? And that means that anyone who might have some detailed information about this could share it. There's another question, which is there appears to be a gap in terms of the strategy in terms of child criminal exploitation. Can anyone take that one on?
I think, David, that I think what isn't completely in the strategy is every single issue. Certainly I've made a note to myself to take that to that workshop group to flesh that out a little bit and to see whether we can strengthen the strategy by talking about that. But certainly those are the sorts of issues that we'd absolutely want to address from a sort of prevention perspective. So I guess it's about making sure that we can articulate that a bit stronger, that I can find out a bit more about where that work is happening and that we can include that in the strategy. So thank you for the comments around that. That's really helpful.
Yeah, could I just say that if there are any questions, either in this main session or in the breakaway groups, that we're not able to provide a really clear answer on, we will make sure that we chase an answer, and again make sure that that's made available to everyone afterwards. Another comment in the chat is that folks were really pleased to see that trauma and the experience of being a looked after child have been acknowledged as predisposing risks in terms of emotional and mental health. But the comment was that it wasn't clear how this is addressed specifically in the strategic delivery. Is there going to be additional work around this to address the inequality of well-being and mental health outcomes?
Yeah, I think that the action areas in the strategy are going to describe the groups that are going to take forward those action areas, which will include particularly that focus on trauma, certainly the support for children who are looked after. What the expectation is that there'll be a Sussex-wide group that will be working and looking at that and working up the detail, but there's some acknowledgement that some of these things will happen differently in different parts of Sussex. So some of that will be in the local implementation plan as well. But we will be expecting that to be fleshed out within the groups that are going to take forward those particular actions. So again, you know, we'll make sure that as we know a little bit more about that, that we can share that with you.
Okay, that's great. Someone asked for explanation of acronyms, and the only one I can see in the chat that's not been explained is PPI. That usually means patient and public involvement.
Just to say, David, somebody's raised their hand. Atia.
Yeah, thank you. So I'm raising my hand because Simone was just saying there might be other people on the call who might be able to answer some of the questions. So first of all, to say I'm Atia Gola, and I'm from East Sussex County Council. So I'm not able to answer for the whole of Sussex, but there was a question about some of the work, David, you were around the priority groups, looked after children, the work around the sort of wider determinants in relation to child exploitation, substance misuse, etc. And as Simone was saying, those three implementation groups, East Sussex, West Sussex, and Brighton, are a really good place for you as part of a sector connector partners here to have a voice and influence. There is a voluntary sector rep there. I know particularly from East Sussex, it's YMCA Downlink Group colleague Rachel Brett. But I think I was just thinking that it might be useful as chair to circulate, and Simone, I'm just saying this and I'm hoping you think it's okay, circulate the names of the leads of those groups, because then people have a way in relation to who to ask, because Simone won't have all the answers as a sort of Sussex-wide around the strategy, but in terms of raising questions about particular cohorts and your concerns about particular groups, it would be good to get that raised at the implementation group. I'll put the name of the East Sussex co-chairs, but I think it would be good to add in the others so you have that for people to know and to be able to drop emails to, because they want to hear definitely from partners and peoples across all the sectors.
That's really, really helpful, and we'll scoop up that information and make sure it's sent out to people, made available.
We could probably put some of that in the chat now, actually, David, if that's helpful.
Yeah, put it in the chat, but we'll also make sure that in the kind of follow-up papers or the follow-up link, we include that. What we're likely to do, folks, instead of mass emailing loads and loads and loads of material to all of you, which hasn't worked really well in the past, what we usually do is create a web page as a kind of resource page, and we'll send you out the link to it. Okay.
David,
but yeah.
Caroline Davis has got her hand up as well.
Okay, I'll come to Caroline just a second. We've probably got time for two more questions. So Caroline, with you in a second, but Someone's put something in the chat a long time ago, and I just want to cover it. How does the priority of early help and access align with the closure and reduction of early help and find it out centres across West Sussex? Actually, that may be one for the West Sussex breakaway group. But does anybody want to quickly address that?
It certainly wouldn't be one for me to address, because I think that is that's a local authority comment that needs to be made. I think it's probably better made and discussed in that West Sussex group, David, as you said.
Okay, so we'll that's what we'll do. We'll hand it over to the West Sussex group, but if the answer still isn't there, then we'll go seeking the answer for you folks and provide a written answer in the follow-up paperwork. Okay, Caroline, sorry for keeping you waiting. We've time for you.
I'll keep it really fast. Just to respond to the last, the East Sussex colleague. We are a Brighton-based forum, community forum called Fresh Youth Perspectives, and we channel the voice of young people that have been criminally exploited from Brighton to Worthing to Crawley to London, as in like those are the areas of the parents and carers we support and the young people. So if you do want to hear the voices of young people where mental health is an underlying vulnerability, when they are groomed by gangs and organised crime, I think it's really important because it's one thing that's really overlooked, especially like clinical time, for instance, within the youth offending system, within custody. So I did notice that there is time for child sexual exploitation, but I just think the child criminal exploitation is very different and it can affect all young people from every social economic background, but the one theme is underlying mental health. Thank you. I'll write to Simone and give our details. So if you do have any consultations, maybe we can bring the voice to the table. Thank you.
That's great, Caroline. And of course, it reminds me to say to folks that we hope it's okay with everyone that we share people's details of everyone that's attended the meeting. If you've got a problem with that, then please let us know. We'll leave you out. Okay, folks. So we've run out of time for this session. Actually, like right on the minute. So if you just bear with us for a few moments while we once again enjoy the wonders of modern technology and ask Hattie if she can split us up into our different breakaway groups. Thank you very much.
David, is it just helpful to say that we're not going to be coming back to a main session afterwards? Just so that
You prompted me to mention two things really quickly. One is just that we're not going to come back for a plenary, and the reason for that is when we've done these kinds of sessions in the past, the breakaway groups tend to last different lengths of time. So we had one on one occasion that was kind of wrapped up in 20 minutes, and then they had to sit around waiting for a plenary to start. On the other hand, we had one that actually went on for an hour instead of half an hour, and they all agreed to stay on because they were having such a great discussion. And they didn't want to come back into a plenary. They wanted the freedom to be able to end when they wanted to. So that's why we're not doing that. And the other thing is, I was prompted just to remind people that the responsibility for Foundations for Our Future and for implementing the strategy doesn't just rest with SPFT. It's not just with the Mental Health Trust. This is something that everyone in the whole system-wide, needs to take a responsibility for making sure this happens and happens well. And my suggestion is that everyone at the end of this whole forum, make yourself a promise about what it is you're going to do to help and implement the strategy, help and push things forward. And then in a few weeks' time, maybe whenever you get, or a couple of weeks' time, when you get the link out from us and the follow-up information, just check with yourself whether you've done anything towards that individual objective. Okay, having said that, we now will put ourselves in Hattie's hands and head off to our breakaway groups. Thank you all very, very much for coming, and thank you for the very kind of enthusiastic engagement in our session today.
Well, I think some of you, I've struggled to find you on my list. So you're going to have to help me put you in your right groups. So can I start with you, Holly?
Yeah, it's Brighton and Hove. I should be East Sussex.
Brighton and Hove, okay.
No, sorry, East Sussex.
Michelle, you should be in your... Are you still here?
I'm down as Hattie.
Oh, yeah, I know.
That's kind of weird. I did go through the office.
Oh, did you?
So I wonder if you have to move yourself.
Francis, which group are you? Do I have any Francis?
Hi, I'm from West Sussex.
Oh, yeah.
Hattie, are you able to
Sussex,
move me?
yeah. Michelle, there you go.
Brilliant, thank you.
I've got Joyce.
David, do you want to introduce yourself?
Yeah, hi, my name is David Liley. I'm Chief Officer of Health Watch in Brighton and Hove. And if things are wrong with services, it's probably my fault because I used to be Director of Mental Health Services in Brighton many years ago.
Thanks, David. Simon?
I think I've introduced myself to death. I'm Simon Button. I'm Programme Director for Foundations for Our Future.
Cheers, Simon. Caroline?
Co-chair of community organisation Fresh Youth Perspectives, and we deal with all levels of mental health from low level to high, and we seem to have veered into the specialist area of child criminal exploitation because the huge demand and need for it, and we also are part of a parliamentary group on this nationally. Thanks.
Great. Alice?
Hi, I'm Alice, and I work for Marine Conservation Society, who are 2 points really. We have some funding for kind of free beach events for young adults over the next 2 years, and so just interested to see with a particular kind of thrust on supporting mental health and wellbeing. Also part of the kind of West Sussex Youth Voice Network. So just interested to see how we can help be part of the solutions.
Great, thanks, Alice. It's lovely to have you here today. Will?
Hi, I'm Will. I'm a project coordinator with Health Watch Brighton and Hove.
Thanks, Will. Josh?
Hi, I'm Josh. I am here representing Different Noise today. I'm a director at Different Noise. You won't have heard of us because we're in the setting up phase of things at the moment. So I'm just kind of here gathering information. But yeah, the aim, just really quickly for us, is working with young people in a very broad setting, whether that's mental health or kind of small time projects about anything that they want to change in their community in order to help develop it, and just kind of projects that young people want to do that might be ignored by other services, as well as being able to work with other services to help support them and their young people with their projects.
Great, thanks, Josh. And can I just say it's great to have a youth director around Brighton Hove looking at mental health services and how we can support our children and young people. Clarky, that's what you've come up as?
I know it's some Patience, but it's okay. So my name is Patience Clark. I work for Sussex Partnership Foundation Trust, and I am a clinical service manager for Brighton and Hove neurodevelopmental pathway, which is new at the moment to look at reducing wait list and making sure that young people can access assessments for ADHD and ASC. Yeah, if anyone needs to ask any more questions, I'm here to answer anything relating to that. Thank you.
Thank you, Patience, for joining us today. Conrad.
Hi everyone, I'm Conrad Foote. I'm the service manager for Brighton Hove Wellbeing Service. So I'm employed by YMCA Downsland Group in partnership with SBFT for the Wellbeing Service. So We support children and young people ages 2 to 24 with mild to moderate health support.
Thank you, Conrad. Excuse my dyslexia. Is it Clary? Clary?
Hi there. You've pronounced it really perfectly, actually. It's Clary. So I'm a project officer and I work for Brighton and Hove Health Watch. Nice to meet you all.
Thank you for joining us today. Michelle?
Hi there, I'm Michelle. I'm one of the project coordinators at Health Watch Brighton and Hove.
Thanks, Michelle. Lester? Are you struggling to get off mute, Lester?
Yeah, I think I'm all right now. I'm on the old mobile phone. So hi, everyone. I'm Lester and I'm a researcher and staff member at Health Watch Brighton and Hove.
Perfect. Thank you for joining us today. Nicola?
Hi, I'm Nicola from YMCA Downslink Group. I am the Digital and Youth Engagement Lead. So I look after our digital and mental health products as well as youth participation.
Great. Sarah?
Hi, I'm Sarah and I'm doing a piece of independent scoping work for the Sussex Health and Care Partnership, sorry, the abbreviations, participation across the Mental Health Collaborative, and have also been the independent chair for the Principal Ways of Working group across Sussex.
Great, thanks, Sarah. And lastly, but not least, Nick.
Hi, Josh. Thanks so much. Hi, everybody. I'm Nick White. I'm consultant clinical psychologist working Brighton and Hove. I'm very lucky I joined the patch very recently in January and have previously worked for 6 years in Hampshire CAMHS.
Great. Thank you, Nick. So as I said earlier, we're going to look at two kind of main questions today for you. And we're going to try and not keep you long, but it would be really beneficial, I think, if we have some kind of in-depth discussions and really think about how we can progress this strategy forward in our local area. So my first question for you today is, how can the strategy be taken forward locally? What are the barriers and opportunities within this? So I don't know if anyone's eager to kind of jump at that question to start with, but that's really looking at your personal services as well as the kind of wider system approach and how you see those barriers and opportunities, and how can that strategy be taken forward? And I've stunned you all.
I'm really sorry to be a pain, but would you mind telling us which strategy you mean and providing a link to it? I'm so sorry that I haven't obviously done the pre-reading that I needed to.
So the strategy we're looking at is the Foundations for Our Future strategy 2023 to 27. I believe those dates are correct. Someone will correct me if they're not. And Michelle, are you able to just email Alice over the strategy so she's got a copy of it?
Yeah, I should be able to do that, yeah. Thank
you. Simone, would it be helpful if you just, as people are unaware of the strategy, just give a kind of couple of minutes on that strategy?
Well, I guess it's what I talked about earlier on with. So what we're trying to do is to have a strategic approach of how we will improve children and young people's emotional well-being and mental health. And within the strategy, we want to not just be focused on the specialist support that can be required for young people who've got some quite significant mental health difficulties, but also how do we keep young people well, so the whole prevention end, as well as providing earlier intervention. And as David alluded to earlier on, it really is something that everybody has a part to play, because there are all sorts of social determinants and early things that we can do to keep people well, to develop young people's resilience. We want to include that whole pathway from there all the way up to those young people who are going to require much more intensive and specialist support because their needs are more complex. And everybody in between as well. And we want to make sure that it's easy to get the support that young people need, and that they are very much in the centre as we take this work forward. I think the implementation is going to be particularly important and interesting. And we really want to involve young people and families, as well as other key stakeholders in that implementation part as well. So in a nutshell, and in a few lines, that's what it is. Hopefully, that's refreshed people's memories.
Thanks, Simon. Alice, does that help slightly?
Yeah, I found it. I'm so sorry. Thank you for that.
Not a problem at all. David, go.
Yeah, I was just going to say, I guess in terms of implementing the strategy in Brighton and Hove, I guess there'll be a kind of like a formal structure for that. There'll be things that will be happening through meetings and formal links between commissioners, providers, and all that kind of thing. But it strikes me that we've got several people here from organisations that are not in the middle of all of that. They're much more about helping young people's emotional mental health through purposeful activity, through getting engaged in events and so on. What part can those organisations play in implementing the strategy? Simone?
I mean, I guess I think you're right, David. There will be a group locally in Brighton that is going to take forward this work. So there's a local emotional wellbeing and mental health partnership group, and Josh, I think you sit on that as well, don't you? And that will be the main vehicle to steer the delivery of that and the development of that implementation group. But I think we need to think about how we have those conversations with all local partners and how we engage everybody. So this is something I don't think that we're determining how to do it, but I think any ideas that you have collectively as to how you might want to be engaged, we can sort of feed into that group and make sure that they can reach out to you, and whether that is coming to existing groups that you belong to. I'm not familiar enough with the infrastructure of Brighton in terms of whether there is a voluntary sector group that actually we could be connecting with to make sure that we can think of how you will connect with the development of the strategy. David's earlier point, what will you bring to it? What is your role? What's your pledge? And how can you help? Because everybody has a role to play. Every organisation, every service, every individual will have a role to play in the delivery of this. So I'm open to ideas, I suppose, is the short answer, David, and I don't think we are being prescriptive about it, but we want to be inclusive. So ideas that people have, just let us know.
Great, thanks, Simon. Josh, did you want to come in there?
Yeah, so I've got a kind of idea, really. I mean, me personally, I think what is really important to kind of remember and to understand is within our individual services, our young people have come to us because they share a relevance to our specific service. And it is us running these services that will understand what it is our young people need best, as opposed to one kind of central thing, creating a generalistic idea that we can move forward with. I think it's important to involve as many services as we can in this as a whole, and use them to talk to their young people and ask them what it is that would best individually fit their young people. Because, for instance, what the YMCA might do with their young people would be completely different to what another service would do with their young people, and it just wouldn't fit rightly with as many young people as we would need to reach if we were all just doing it as a collective whole. We would be missing out a lot of young people and letting them fall through the gaps, which is the complete opposite to what we want to be doing with Foundations for Our Future.
Yeah, Josh, I completely agree. And I've definitely seen some heads nodding around the room. And that's definitely a barrier that I think we're going to be looking at, is how we can inclusively include everyone while keeping a kind of Sussex-wide structure around that bigger picture. Because there has to be a structure for it to work. Otherwise, all the work's going to fall apart that we've already done. But it is about being flexible with individual services to how they implement it directly for them. Caroline,
Thank you. Yeah, I concur, Josh. One for cascading is what Simone and David both mentioned. Through Healthwatch, Community Works hosts around 3,000 community groups and charities in Brighton and Hove and also across Worthing. Josh must have, are you a member of Community Works as well? Yeah, so a lot of youth groups are, so that's another way of getting many voices. Again, I would say getting the hidden voices, those of young people who are educationally excluded, whereas we all know behaviour sanctions often happen for young people. And I will say this as a mum of dual heritage children as well, when there is race and mental health intersectionality, I definitely like to see a theme where there's racial diversity looked at, and that's something where, you know, the young people from diverse backgrounds can input into in a safe space. The other question you asked about barriers, I would say the lack of trust, because you're setting up a great new scheme here, but there's been other initiatives, and the timely waits means that there's a lack of trust in, oh, here we go again. So something about this engagement is slightly different, maybe because you got young people in the co-production. So I think you actually communicated that really well. Also, the fact that there's a massive over demand for the service because of COVID and the pandemic. So those with underlying health conditions is exacerbated. And then there's young people that, you know, they're new to the service. So maybe something about that and the pandemic and sort of solutions out of it. Those would be my suggestions. Thank you.
Thank you, Caroline, and some really good input there. I think race definitely, and a minority, all of the minority groups that we all work with on a day-to-day basis is something that we really need to get right. And I know it's something that Foundations for Our Future are going to be working hard to get right. Again, Community Works, a great kind of collaboration of different services there, and it's definitely something we'll look into using and working closely with as we go through the next part of our strategy, I suppose. Nick.
Thanks, Josh. I suppose I was just extending really what Josh M was saying around, I suppose, the way in which we, as a community of different services, tune in to the individual experiences of our young people and families. So what struck me was that in the strategy there, it talks about the intention to support young people around their goals and outcomes. And I suppose it's about how we gain a voice and understand that actually not all of those goals will be the same for everybody. As I think Josh, you said, you know, it's not one size fits all. Actually, one person's aim in terms of their mental well-being could well be very different from another person's aim in terms of their mental well-being. And I think it's a thread we're trying to pick up in CAMS as a specific service, but I think across the strategy, it's about how we embed that theme, that actually, as much as possible, it's about, I think Josh M, you mentioned that, you know, that the young people you might be speaking to, and you would go to, say, YMCA, and they may have those, you know, very different take on things. So there were definitely themes, weren't there, across our footprint in Brighton and Hove. But I just was reflecting on the importance that when we're having discussions as agencies, is that one of our first bits on the agenda is, well, we've got this idea for supporting out this, you know, this group or this particular you know, setting, is the question of, okay, so if we're using the word goal, are we using the word goal in the same way? And most importantly, are we using the word goal that's suitable to that population of children and young people and their families? Because I think that's where the communication can be lost within services. So it makes me curious about how we can be interested to get sort of a sense. I know with Simone, your presentation, the Foundations for Future has drawn from a lot of different advisory groups, but I think it's the importance of keeping that voice alive in that process. So it's not we've done it and then let's deliver it. It's about that constant dialogue of, well, actually our goals have changed, you know, as you were just alluding to there, Caroline, post-COVID. But I could talk about it for a long time, but I just was really struck in the strategy that word goals and how we make that tuned to our young people as much as possible in our locality.
Great, thank you, Nick. And I agree that goals is such a wide word, but also such a small word when you look at it from different aspects. And we need to make sure that we're helping providers to fit their goals as well as system-wide goals. Will, do you have a technical question, or was it a Healthwatch question?
No, it was just in terms of talking about sort of engagement.
I'll go through the list then, Will. Is that all right? And come back.
Yeah, absolutely.
Simon, did you want to kind of jump in with a reply to Will, or was it an overall?
Well, if I may,
of course.
Just because there's 2 points that I wanted to just pick up on, something that Caroline said and something that Nick said, really. So it's not an answer, it's my own opinion, I suppose, just in reverse order. And I wonder, Nick, whether some of the sort of like not losing that individual perspective and being very focused on, you know, each person is different. We can put people in categories, we can talk about themes, but actually every young person is different. And how do we hold on to that? I guess for me, that's where I think implementing that Thrive framework is going to be so important. But I suppose with that, and it really links with some of the barriers that Caroline talked about, because I think there's a massive cultural shift that we need to collectively engage in. And Thrive talks quite a lot about, you know, using a particular language, but also the cultural barriers we need to get over to be thinking in quite a different way. And with Thrive, you know, with thinking about how do you really meaningfully involve that young person in a shared decision making in a truly authentic way, I think is a change. I think we talk a lot about it, but I'm not sure that we're not always thinking about it in that way. So that was one point I wanted to make. The other thing, again, I suppose relates to Caroline's point about the demand for services as a result of COVID. And I think this again is one of the barriers and the challenges, is because there is even more pressure on and more young people are more unwell than they have been before. And let's face it, specialist services were always stretched and are now more so. But there is a danger that we will continue putting money just into specialist services, and we will just think about how to manage that demand. And if we don't do something differently soon, in terms of really thinking about the resilience, the prevention, the earlier intervention, I don't think anything's going to change. And I think that's a massive challenge, because although, you know, the government and nationally, we talk about all of the money that's coming into children and young people's mental health, we still have got quite a big gap between what we want to invest in and where we are now. And so, you know, I'm just speaking personally, really. I think those are some of the important challenges that we need to try and find a way around. That's where I think all of you guys, it's really important, because some of that is about doing things differently, isn't it? And a commitment to do something differently. But anyway, I'll shut up now.
Thanks, Simon. It's always great to hear from you. Michelle, just while I've got the mic, can you just check your emails when you get a second? Alice, over to you.
Thank you. I just wanted to, I mean, having had a really quick scroll through, I find the strategy really interesting in that it talks a lot about the influence of like built environment and not so much on natural environment. And, you know, like to me, that's really quite a big point, is actually the connection between the two for young people to be able to access like mental health support independently as well as with their peers is like a really big thing. So I'm sorry if that is something that is an obvious break, but I just couldn't really kind of see that in there. And, you know, also in terms of like mental health support, I mean, not just, I know I'm coming at it from like a C perspective, but I wonder if there's something about breaking down the barriers between like environmental charities and youth service providers, because, you know, accessing green space as well as blue space is like so good for you. And in my kind of short experience in kind of working with youth support providers, there's a kind of lot of anxiety around going into natural environment, and quite a lot of like youth support leaders perhaps aren't like unfamiliar with taking young people onto the beach or what have you. And so is there something that like environmental charities can like lend their expertise to that would really help support this strategy? And, you know, natural space is often free to access, so that's something that could anyway happen at any time. Thank you.
Thanks, Alice. And I completely agree. We've got so many green spaces around our local area, and we're a green city. Well, definitely Brighton Hove is a green city, and looking at ways we can use those spaces. It was only the other week, me and Simone were having a conversation with some other partners about equine therapy and how that can be beneficial to young people. So definitely kind of getting ideas like that going, and how we can use our kind of community voluntary partners to really embed that will be a great step forward. David, I will come to you and then I will go to Conrad.
Okay, I'll just drop my hand. Equine therapy. So is that my, so if anyone's got a good tip for the horses, that'd be really handy. It was just expanding out a little bit, Alice, on the point you were making, because I've been sitting jotting a few things down about how we can better make links between the strategy, mental health services, and organisations like yours that have got a just as meaningful, but a softer touch and a softer relationship with young people. So one was definitely the thing that Caroline said about cascading information. But I also thought about three other things. One was making sure that you guys understand how you can help young people get access to extra help. So that kind of making sure there are clear messages for you to be able to pass on, and meaningful messages, not just here's a website or here's a phone number, whenever we all know that actually the website information is out of date and the phone number will just lead you to an 18-month or 2-year waiting list. So some kind of meaningful information to you folks. I think a second thing was, I think you guys have got the potential to really help us to carry key messages to young people about emotional and mental health. And that leads me on to the third point, which is linked to that. One thing that we've learned in Health Watch, because our job is to represent the views of patients and the public, is that there's nothing substitutes for getting out there and meeting people, just as much informally as formally. The solution to implementing the strategy is not going to be in agendas and minutes and meeting rooms. It's going to be in doing things like actually going down on the beach and joining in, chatting to people, picking up key messages and handing key messages over. So I think the work you're doing and that others are doing is actually really inspiring. I know the work that YMCA does is really inspiring because they provide Young Health Watch for us. But those are just a few of my ideas, a few reactions to what you were saying, Alice. I think it's very, very relevant to the strategy.
Thanks, David. There's some really great points there. Conrad.
Hi, just thinking about the challenge of the SPOA, the single point of access as well, and particularly around accessibility. It gives a big opportunity for all of us that are on the call, we're working in participation and experts by experience to be able to test the patient journey along as that's being prepared and the early planning stages of the SPOA, particularly if we've got different admin entry points and things like that, and just to test out if those accessibility points are good enough. I suppose my main concern is that we're currently in Brighton Hove very heavy on web-based online referrals, mostly due to the pandemic as well. But making sure, because of course we don't know who we're missing out, we don't know who's not accessing online support, so the demand maybe should be way higher than we're seeing right now, and so it'd be good to look at those entry points at different places within the SPOA that all feeds into one single point of access, but making sure that that's adequate enough and to test that patient journey in those early stages.
Conrad, that's great. I'm actually going to put that kind of thought on hold for a second and come back to it, because my second question to you guys today is how can we embed children and young people co-production and co-design into the strategy? So if we can hold that thought, if that's okay, Conrad, and we will rethink it in a moment. Will.
Hi. Mine is about that. Is about having the sort of involvement and families of young people in that. So I don't know if that touches on that point, but it's very much that I think it's absolutely crucial that they're involved in the planning part of this. You know, Community Work's a great organisation. Amaze is a great organisation there that you know, they got parent groups that they can connect to on that. You know, CAMS have a lot of people that they can connect to, the integrated team for families. Yeah, I think the key thing is, you know, we talk about a cultural difference out there. There is a cultural difference between a professional and a parent, and that plays a part so many times. And if you want the people to trust you, I think some of the sort of charitable organisations or third sector organisations are ideal in that. But that's a key part to me of just having that as part of the framework built into it, rather than just something that's laid on the top. It's a very different perspective from a young person or a family to when you deal with the professionals, and sometimes they don't quite get that.
No, completely, Will. Thanks for that. And I think that's probably the part I'm most passionate about. And I've spent many an hour moaning at Simone and pushing Simone in certain directions about co-production, because as you heard earlier, myself, Ed and Amy are really devoted and committed to creating services with young people rather than for young people. And I think if we start at a strategy, then we'll get it right. But there's no point kind of doing our basic co-production that a lot of our partners are used to back in the day, where we do an hour consultation once a year and then it doesn't go anywhere because that's all they're doing. The strategy is very much about having children and young people at the heart of it, designing it, using it, and then enabling partners to use it as well. And getting all of our third sector partners, our community voluntary partners, to use co-production as well is vital to getting this right from our point of view. Josh, is yours child related or is it strategy related?
It's a bit of both.
Go.
Okay, so basically this probably is the young person in me kind of coming out here. But I mean, it's easy for us sat here kind of talking about how it is best for us to implement these strategies into our services, you know, into our young people. But I think the thing that really strikes me and what would be really important is, you know, although we know our young people ourselves, our young people know themselves the best. Our young people will know what best ways would be to implement it amongst themselves. And I think it's important to kind of, you know, actually we need to have these meetings ourselves as, you know, the representatives of our, you know, communities and whatnot. But it's also important to have our young people, giving them access to meetings like these, giving them a chance to speak and give their opinions, because, you know, I know some services, you know, decisions are made for young people, and young people are kind of then given that choice to do it. And, you know, I don't want to step on anyone's toes here or whatever, but some services are top down, and it is a real kind of issue, because although it is young people then getting involved in them strategies, it's not young people choosing them strategies. And it's, you know, if we want young people to make a difference in their communities and to, you know, have a choice on how things are implemented, we need them to make them decisions. We need them to have the options that we have and have the resources that we are given, and to work not for them, but with them.
Thanks, Josh. I can hear that passion coming out as a child that's experienced services just like I have. I think in a way I can give you a reply to that. So something we are currently doing is working as a Sussex whole, creating 3 place people panels. So East Sussex, West Sussex and Brighton and Hove are all going to have a probably 4 or 5 times a year we will do a 2 to 3 hour kind of consultation like this with young people and really get their views into what we're doing at the time. So looking at kind of single point of access, looking at the Thrive framework, And then people like myself, Ed and Amy, are taking those into like the Foundations for Our Future project group, the oversight board, and eventually into the overarching kind of boards when Foundations for Our Future finishes. I hope that kind of helps a little bit, but it's not something I'm going to stop pushing on because we are all very passionate about young people's voice. Patience.
One of the things, Josh, that I've been pushing for, and I think we're making some ground in it, is for more of the decision-making meetings. Meetings where resources are allocated, decisions are made about workforce, that kind of thing. But more and more of those should be meetings held in public. So not public meetings, but meetings held in public. So young people and others could actually come along, observe what's going on, and have an opportunity to comment on it, and perhaps have a fixed part of the meeting where they could ask questions and receive a formal answer. I think that's a really good model for the future, and something that could, in a way, kind of democratize and socialize a lot of the business that goes on behind closed doors at the minute.
Yeah, no, definitely, David. It's definitely a pattern we'll look at and see if we can implement certain parts of their kind of ways of working. Patience, I know you had a hand up for a long time and then you've lowered it. Did you still want a hand?
It's okay. I just wanted, it was just a comment really on what, I mean, I know you asked a question earlier about opportunities, and I'm just thinking about what you're talking about, embedding that into the services. So we are at the improving support part of the service really, and specialist pathways and neurodevelopmental pathway. And we've got an opportune moment to be involving young people and listening to their voices in terms of developing our pathway, and because they are going to be using it. But it's quite interesting, and I've been challenged today just listening to what Josh, even you were saying about young people, and most of the work we've been doing, because we are trying to incorporate all the strategies that Simon was just talking about, in terms of we are involved in the SPOR, we are involved in listening to voices of young, but I've realized that we are more linked in with the parent carer forums more than the young people. And it's just, made me realize that, oh my goodness. But although we do have, and we are making some headway, we've got a participation manager in our CAMS team who is trying to work with young people, trying to involve young people in terms of the services that we are developing to make sure that they are suited for young people, because they are for young people. I guess it takes a little bit longer, and it's taking a little bit longer to get young people's voices into that than probably we would like. So it would be good to tap into any forums we can of young people who can be that voice at this stage where we're actually still developing the pathway, and we're making referral forms and everything about what the service should be like, but not actually thinking about who is going to be using it and whether it's
definitely
to be user friendly.
And I'm sorry it's challenged you, but I also think challenge is good, and it makes us think and it makes us work harder. I will definitely email you over a list of groups that we connect with on a regular basis for participation work and collaboratively designed and delivery work, because there's definitely some young voices that I'm sure would be keen to speak to you in there.
Yeah, definitely. That would be brilliant, because our participation manager is new and she's very keen to get involved in even our interviews, everything that we are doing to make sure that we've got young people's voices there. And we were talking about it earlier today in the meeting about how she's going to help the team to kind of just get a feel of the insight of how much the members of staff feel that where young people's participation could fit in within the service. And we're just looking at that and how we can work with staff to make sure that we incorporate that in every process we do.
Definitely, Patience. I'll send you that email later today or tomorrow, and I'll also link you
That's
in
brilliant.
with Cummings, who is the Sussex CCG participation lead.
Thank you.
Those two might be able to have some good conversations. Nicola, thanks for waiting.
That's okay. Yeah, I just wanted to point out that the work that's already sort of taken place in terms of engaging with young people and getting their views in terms of Foundations for Our Future has been fantastic. It's been really, really good. And you can see from the strategy itself that it's youth-led. There's been a lot of co-production, and it's wonderful. It's wonderful to have been a part of it and to see the other youth organisations a part of it. In terms of embedding the strategy itself, I think is great, but I think there's that lovely infographic that we didn't get to see, unfortunately. It would be a really good, first of all, possibly having a really strong comms strategy. So the current organisations that are involved, you spoke of different people place panels, ensuring that they're sort of aware of this strategy, but perhaps taking out that infographic and having that as a single document, and then getting young people to help flesh out those different areas. So I know what a single point of access is, but a young person may not, or even someone working within this field may not be aware of it. So I would say looking at the strategy itself, the infographic, which is really nice and colourful, but potentially fleshing that out a little bit more with young people sort of getting involved in that and having that as a single document by itself. It's also really important, I think some people have already mentioned about hard to reach groups, particularly young people of colour, disadvantaged young people, but I would also say about digital poverty. There is mention of digital services within the document. And I know that some of the different SPOAs are looking at place-based SPOAs, some are looking at purely digital. I think it's really important that we are factoring in young people's access to digital devices, being able to get support for their mental health. So I think that would be a really key one to explore. But yeah, keep up the great work.
Thank you, Nicola. And we don't work with each other often enough, considering I've had a lot of conversations with YMCA before. It's definitely the digital pathway is something that we will be looking at. I think Simon will agree there, and just making sure that we are fully accessible to everyone in Sussex, because as you say, digital poverty is such a big thing in this day and age. And even indirect digital poverty, people just may not want to use the technology even though they have access to the technology.
Yeah, definitely. And I would say, particularly in terms of Foundations for Our Future, it's making sure things are really simple, because there will be some people that are neurodiverse, people that have different learning abilities, but the document that we've got is wonderful, but I would say breaking it down, chunking it, so people can access it at different points and just view what they need. Because I think if we're trying to embed it into, for instance, YMCA, parts of SPFT or all sorts, they're going to have different angles from an LGBTQ perspective, but making it really simple and clear and thinking of those different areas. But yeah, keep up the great work.
Thank you, Nicola. That's definitely something we'll take forward and look at how we can do. David.
I have three quick things. One is I've often wondered if we could try and get decision makers in different bits of the system, not just the Mental Health Trust, but right across the board, to accept the principle that with children and young people services, that no major change in service design or implementation and no major financial investment can be made unless there's a tangible demonstration that young people have been involved in the system design or implementation process. It's kind of like the decision makers in the system imposing a discipline on themselves. Maybe that's just another one of my pipe dreams that I'll keep on tooting the horn about. The second thing I wanted to mention is just time, Josh. We're almost at 10 to 6, and folks signed up until past, but we've had such a great free-flowing conversation that I realize everyone stayed, no one's gone, but it's only fair that we kind of like draw a line at some point. And the last thing is when everybody else signs off, can my team just stay for a minute or two? Have a chat with me, okay?
I'm going to say yes on their behalf that they'll stay, David. And I agree that time is getting on. I suppose from my point of view, I don't think ever limiting these conversations is ideal, because actually if people are engaged in the conversation and letting it flow is the best way to do it. I think definitely looking at having some more of these conversations going forward in the future is going to be beneficial to us all. Maybe another Sector Connect or maybe a similar aspect. What I would say is definitely take these conversations forward into your work streams, into your meetings. Make promises to yourself about how you can embed strategy into your service, how you can embed co-production into your service, and how you can embed youth voice into your service. I know people like Nicola do it very well and do it on a daily basis, and I'd just like to see that kind of go across the board into all of our services, so that our services are about children and young people, because that's what they're designed for. So let's kind of embed